Good evening, and thank you for joining us for the third of a series of ballot measures hosted by the Council of Neighbors and Organizations. During these webinars, proponents and opponents of the measures discuss their positions and answer audience questions. The Council of Neighbors and Organizations is dedicated to empowering neighborhoods to improve their communities through education and connection. We help our neighbors connect through events, build resources for their organizations and the leadership of neighborhoods, and promote and strengthen civic engagement. And that effort is, this is part of that effort tonight. Tonight, we will address Proposition 118 that creates a state-paid family and medical insurance program funded by employer and employee payroll premiums that begins in 2023. It will allow eligible employees up to 12 weeks of paid family medical leave insurance benefits annually. Benefits will be available beginning in 2024 and create job protections for employees who take family and medical leave. We are grateful to have with us Ashley Pinelli, who will be speaking on behalf of Proposition 118, and Rachel Beck, who will speak against the proposition. My name is Richard Strasbaugh, and I'll be moderating on behalf of the Council of Neighbors and Organizations. Ashley Pinelli is the Associate State Director of 9 to 5 Colorado, an economic justice organization that works to create systemic change through issues-based advocacy and grassroots organizing and community education by directly engaging impacted women. She is co-chair of Colorado Families First, the coalition leading the Yes on 118 campaign. Ashley has advocated for the creation of a state-run paid family and medical leave program for several years. Rachel Beck has 20 years experience in municipal and state government policy, research, and strategic communications. She is currently Vice President of Government Affairs for the Colorado Springs Chamber of Commerce and the Economic Development Corporation. During her career, Rachel has helped businesses and citizens access their government and influence community outcomes, and has helped craft initiatives to improve the Pikes Peak region's infrastructure and land use. Her accomplishments include building the Chamber and EDC's government affairs program and steering multiple local ballot initiative campaigns to succeed. Thank you for both coming to this event. We appreciate your participation. For those who are listening, if you would like to ask a question, please click on the Q&A icon at the bottom of your screen and type in your question. We will begin with both Rachel and Ashley's initial statements. And Ashley, why don't you begin with that?
Absolutely. Thank you so much for having me here and allowing me to speak on an issue I'm very passionate about. So I just really want to start by stating the problem, and I really want to keep this in mind through the whole discussion, that in Colorado, over 80% of workers don't have access to a comprehensive paid family and medical leave benefit. That's 4 out of 5 workers in Colorado. This problem is disproportionately impacting low-wage workers and women of color specifically, who have the least access to paid leave benefits. I've been organizing and leading on this issue for a few years now, and I've heard countless of stories about how people are forced to make the impossible choice between going back to work when they're unhealthy or unfit, or being so unfit to work because of the severity of their circumstances that they're forced to leave their jobs and lose their income. This is a pervasive problem and a pretty unique one, as the US is only one of 2 countries in the entire world that does not offer a long-term paid leave benefit. So Proposition 118 creates a solution to this problem for Colorado. Prop 118 would create a state-run paid family and medical leave insurance program that would allow workers up to 12 weeks paid time off for parental leave, caretaking leave, leave for survivors of domestic violence, medical leave, as well as military exigency. The program would be accessible to all Colorado workers, full-time, part-time, 1099 contract, sole proprietors, seasonal, and it allows folks to receive wage replacement while you're out on leave. Now, the way this works is that the program is funded by a premium collection split evenly by employers and employees, and the average premium for a Colorado worker is going to come out to about $3.83 a week. The premiums collected would be put into a fund reserved solely for paid family and medical leave wage replacement, and workers would be able to apply to get the leave through the Department of Labor for qualifying purposes and receive wage replacement from that fund. Wage replacement would range from 65 to 90% of a worker's wages, depending on their income level, with the lowest wage workers receiving the highest percentage of that income. The benefit is portable, which means it's attached to the worker. So you can, switch your job and still be able to pay into a state-run pool and receive wage replacement. The only requirement for someone to be eligible for the leave is that they've earned at least $2,500 in the previous year. And job protection for workers would also be a requirement, but only after they have been with an employer for at least 180 days to really show some commitment to that workplace. Small businesses with less than 10 employees would not have to pay the employer portion of the premium. They'd be exempt from that cost. And any business that already offers a comparable paid family and medical leave benefit for their workers would not have to participate in the state-run program. If businesses are doing the right thing, we want them to continue to offer their benefit, and they don't have to worry about this one. Premium collection for this program would begin in 2023, and the program would begin in 2024. So these are the nuts and bolts of the program, and I want to speak very briefly to the importance of implementing this specific program in Colorado. The first thing is that a state-run program is the most affordable option for everyone involved, workers and businesses. Again, with a $3.83 weekly premium deduction, that average cost is about $200 a year. To put that in perspective, in Colorado, to maintain the average income over 12 weeks means that a worker would need to save something like $15,000 for a 3-month time span. Low-wage workers are already living to paycheck, and to ask someone who's making minimum wage to save that much is virtually impossible. And similarly, we want businesses doing this and providing this for their workers, and we know it would be impossible for many of them to pay someone's full paycheck while they're out. So this was really designed with small business input to keep small businesses in mind as well when we crafted this policy. The details of this program were specifically designed to address inequities that we see from lack of access to paid family and medical leave. The length of leave, the premium cost, the amount of wage replacement, who qualifies, all of those factors are in place with the knowledge that this is how to ensure the most vulnerable workers and those with the least access to paid time off are able to utilize the program meaningfully. When a benefit isn't meaningful, people will not take it. And although it seems counterintuitive, we want people taking leave from work. People are not choosing to become ill or injured, but it happens. It will happen to most of us. And these are not the people we want in the workforce. We want healthy workers, productive workers, people who are fit to be working. And we want this not only because it's the right thing to do, which is why we should be considering this first and foremost. This is the right thing to do for our communities, but also because it's the smart thing to do. We're losing billions of dollars from our economy each year from people, mostly women, being pushed out of the workforce for caretaking needs. Businesses that offer paid family and medical leave are showing a higher return on investment in the long run because they're retaining quality employees and they can offer benefits and stay competitive with larger corporations. So there's a lot of research and evidence backing the efficacy of a program like this. 8 other states and Washington, D.C. all have similar programs that are currently flourishing, with many states going back to expand their benefits and lower their premiums. And I'd be happy to share all the research about the viability of the program, including 3 independent expert reports, as well as the actuarial report commissioned by the state and approved by a bipartisan task force for paid family and medical leave, that all point to the fact that this is the best way to implement the program. It's the most affordable, it's the most accessible, and it confirms the solvency of such programs. So Prop 118 is really the best solution to address the lack of paid family and medical leave. We should not delay in creating a program like this. This continues to be a serious problem for the majority of workers in our state that is only being exacerbated by a global health crisis. People need support to care for themselves and their families. No one should have to make the impossible choice between their job, their health, and their family. And this program is just ensuring that workers have a little more support when we're already facing some of the most difficult time in our lives. So I'm definitely asking folks to vote yes for Prop 118 this November.
Thank you, Ashley. Rachel? Rachel, you're muted.
There we go. Sorry, the button disappeared. Fortunately, it tells you another way to unmute. Thank you, Richard and CONO, for having me tonight. I know a lot of you CONO folks because I served 2 terms on the board, and the election forums were always my favorite of all the great things that CONO does in the community. So it's fun to be a participant rather than behind the scenes. The Colorado Springs Chamber and EDC has fought this particular proposal for paid family and medical leave for a number of years because we're really concerned about a number of things in its design. Ashley spoke really eloquently about a lot of the problems that exist for people who don't have paid family and medical leave, and we don't disagree with that. Nobody understands the value of taking care of employees better than the people who depend on them every day to make their businesses run, and that's employers. And that's why so many of our employers already offer these kinds of programs. The problem here is Prop 118's particular way of addressing the program. It would create the most expansive and expensive paid leave program of its kind in the country, funded by a $1.3 billion payroll tax that almost every employer and worker in Colorado would be required to pay. I say almost because there's a couple of minor exemptions, which I'll talk about later. The initial payroll tax that Ashley mentioned can be increased at will by the head of the new State Department that would be created to run the new program. So this program really is far more about government bureaucracy than it is about families. That new State Department will employ 196 new workers in order to administer it. It has about $269 million in operating costs every year just to keep it running. Programs in other states, Ashley mentioned a few of them, have some key differences. They offer more modest benefits and are housed in existing state departments, differences that make them much more affordable and manageable. The Nonpartisan Common Sense Institute and the state legislature's own research service have released studies that show the program will be insolvent in a few years with just moderate usage rates. And that CSI study also noted that the program would disproportionately harm small businesses and those with small profit margins. And we know who those are: restaurants and independent retailers, the same folks that right now are struggling so much thanks to the pandemic. It also noted that the program would likely result in layoffs or cuts to wages or other benefits. I was talking to a restaurant owner who has a local restaurant on Tejon Street in downtown, and she said she looked into this program and had a lot of concerns about it herself, but more important to her was her conversations with her employees about this. And she said, these are folks who are cobbling together multiple part-time jobs. They've got multiple roommates to make ends meet. And she said, I can't even offer them health insurance. I never thought that I'd be the employer who couldn't even offer health insurance, but I can't make the numbers work. And in talking to my employees, they've said, we don't want a dime more coming out of our paychecks because it's hard enough to make ends meet right now. We'd rather have those funds for what we decide we want to spend them on. And she said, I think I have to respect that perspective. We've also have a number of concerns about particulars of the program's design, some of the eligibility requirements. It doesn't dovetail with the federal FMLA, which of course was passed in the early 90s and has provisions for job protection. It's not paid, but it protects jobs when people have to take leave for medical reasons, take care of family members, new babies, that sort of thing. And Ashley mentioned there are a couple of exceptions to who has to pay into the program. Local governments, including school districts, can opt out and not pay the employer share of the program. Their employees do, however, pay their share and are eligible for benefits, which means that larger businesses are going to have to pick up the tab for those workers. So just the devil's in the details, and there's a lot of details in this proposal. It's 35 pages of details and pretty poorly designed. Even the Daily Camera up in Boulder wrote, "This is arguably the most misleading, poorly written ballot issue ever. Great concept, horrible proposition. You should not only vote no, you should also cross off the yes option and write no in that space too." The reason that this is on the ballot after being discussed at the legislature for so many years is because they couldn't come to a consensus on what would actually work for Colorado and what would be fiscally responsible. Even Governor Polis has declined to support the program. So for all of those reasons, we are very much opposed to Prop 118. We would urge you to vote no. And I'll quote the Boulder Daily Camera again, who said, "We should vote no and demand that the legislature write a real family leave law and don't farm their job out once again to a sketchy Washington, D.C. group like the 1630 Project, which wrote this piece of junk." Pretty harsh words.
Thanks, Rachel. You both raised points about this proposition related to the economy. Both sides are claiming it strengthens business. Both sides are claiming that this proposition helps Colorado economy in general. Could you address each other's points that you've made? Ashley, both of you actually have said that small businesses will be harmed with or without this proposition. Could you address each other's points real quick? Ashley, could you start?
Yeah, so, I just want to highlight that, as Rachel said, we've been working on this policy for a number of years. There are several reasons that this didn't come to a legislative solution. One being that this was the most lobbied against bill by corporate lobbyists in the legislature in 2019, really putting legislators in a tough spot to move forward with a program like this. But this has been crafted by dozens of experts in the field, local organizations, including a large constituency of business voices who this is written with business input in mind. And what we are hearing from those folks is that they cannot offer this on their own. A premium-based program will allow them to offer this, and they want to be able to offer it and stay competitive and retain employees. The premium cost is not what we're hearing as an issue. And the concerns that we've heard from small business, we tried very hard to address in this proposal. In original proposals, folks would receive job protection immediately. We heard from small businesses, we'd really like a little more commitment from our workers before we hold somebody's job. So we pushed that back to 6 months on the job, which is a significant concession. With that in mind, hearing those small business voices and putting that in the policy. We have about 180 businesses that have signed on and endorsed this because when you sit down, I understand that this is a scary proposal. Of course, when you throw at numbers like this is $1 billion tax, this is going to make people nervous. But when you sit down with the small business owners that we've talked to and explain the nuts and bolts of the program, it makes quite a bit of sense to them. It gives them peace of mind, and they most often say, yeah, I would love to be able to offer this affordably, and this is allowing me to do so. Otherwise, I'm losing quality employees, and I just can't afford to pay their salary on my own.
Thanks. Rachel, can you respond?
Sure. I've lobbied against this bill for a number of years, and I'm not a corporate lobbyist. I work for a local nonprofit that has a majority share of businesses that are fewer than 25 employees. 68% of our businesses are smaller than 25 employees. And I was also part of the statewide group of business coalitions that really went to the negotiating table in good faith on this last year to try to come up with something that would work for employers and for proponents who, as Ashley said, have some legitimate concerns about how we're taking care of workers, particularly those who are low income and don't have some of the same resources. And I did not feel that there were a lot of concessions made. And I can tell you that colleagues around the state, like the Colorado Chamber, the Grand Junction Chamber, the Hispanic Chamber, the list goes on, also felt like there was not proponents were not willing to move on a lot of the most important provisions to us. And this looks the same as the versions that we have seen every year. So not seeing a lot of movement here.
Thanks. I wondered if we could kind of move on to the solvency argument about this fund. Some opponents are saying, you know, utilization rates are undercounted in the economic forecasts. That'll affect solvency as well as the generosity of the benefits. Can you address that, Ashley? And I guess what voters may be asking is, will this fund ever be funded by general revenue? Will it be self-sustaining forever?
Yeah. So when we're creating a new program like this, like, we have to go by the evidence that we're seeing laid out in front of us rather than speculation about what could happen. And what the evidence is showing us in every other state is that this program is not insolvent. You can call any state department and ask about their programs, and they'll tell you that they're flourishing, that they're expanding benefits, that premiums are lowering. And we, again, have done quite a bit of research over the years. There's a large body of research. I'll reference the expert reports that were commissioned, the actuarial report that was commissioned by the Family and Medical Leave Task Force appointed by the state last year to show that there's just there's a lot of faith in the solvency of this program through those reports, through that empirical evidence, and also just through experiences that we're seeing in other states. I know that folks keep talking about different states' utilization rates, but I just want to say that that's extremely nuanced, right? We have some states where their utilization rate seems high, but it's because, for example, they count pregnancy as family leave and medical leave insurance. So when we're getting into like, well, what about other states' utilization? I think it's important to really dig down into like sort of those differences and note that people are implementing very similar programs. And I know Rachel mentioned that this is going to be the most expansive one, but that's a little subjective. Other states are offering up to 52 weeks of medical leave for folks. I mean, we're talking 12, and other states are doing a full year and are not facing any issues with solvency. As a matter of fact, New Jersey just had to amend their program to say it's doing so well. They had to make an amendment that said that their legislature could not raid their fund to fund other services because the Family and Medical Leave Fund is flourishing. So the evidence is showing us that solvency is not an issue based on the research and the data put together to do this, to implement this program, including the actuarial report, as well as the experience we're seeing in other states.
Rachel?
So I have not heard of a state that offers 52 weeks of paid medical leave. I'm just curious which one that is.
I'm going to pull up the Better Balance website right now, and I'll share the chart with you that compares all the different states' programs.
Cool, thanks. I mentioned two studies earlier that questioned insolvency. One was from the Common Sense Institute, which is a nonpartisan economic research institute. The other was the legislature's own nonpartisan research service. But Ashley had mentioned the task force recommendations, so we can talk about those as well. The task force recommendations are not the exact same as what is included in Prop 118, so there are some differences there. But there were two reports that touched on the utilization question. I should probably back up. There's a couple things that go into solvency. Four things, actually. There's administration costs, which I've talked about. There's utilization rates, so what percentage of people that are eligible are actually going to end up using the program. And then there's how many weeks do they use the program, and what wage replacement rate are they taking based on what they make. So most of this research has focused on the utilization questions. The first paper that was presented to the task force that Ashley referred to concluded that a claims rate of between 5 and 7% was most likely in the long run, and it showed an average length of leave between 8.9 weeks and 11.4 weeks. If the program use was at the high end of that range, 7% and 11.4 weeks of leave, then the maximum wage tax in the ballot initiative as written right now, 1.2%, it concluded would not be sufficient to cover benefits. The second report studied two different potential programs based on different levels of benefits. One was a low benefit program, which only offered 6 weeks of leave, and one was a high benefit program that offered 14 weeks of leave. And so just to keep all these numbers in context, again, Prop 118 would offer 12 weeks of leave with up to 16 for some circumstances for new mothers. For the high benefits program, they showed the premium would increase from 1.18% in the first year to 1.45% in 2033. And so that would also put it above the cap. When you look at other states, they typically have averaged usage rates between 4 and 10%. So I've thrown out a lot of numbers there. And as Ashley said, we don't know what's actually going to happen if this program is passed. We're making our best estimates based on what we see happening in other states and just crunching those numbers.
And I just want to make sure I get back to your last question, Rachel. Rhode Island and California do offer 52 weeks of medical leave. New York and New Jersey actually offer 26. Massachusetts offers 20. So people are offering pretty expansive packages in their states.
Are all of those paid?
Absolutely.
Can you put that in the chat? I would love to look at that.
Absolutely.
Thank you.
Or you can email it to Rachel later. We have a question from a listener. What is the difference between Prop 118 and Prop 69, which was overwhelmingly defeated a couple of years ago? Rachel, why don't you take that one?
I'm afraid I can't, Richard. I'm not familiar with Prop 69.
You know, I'm not either. Ashley, do you know?
Yeah, my understanding is, please don't quote me, but my understanding is Prop 69 was an initiative to amend the Constitution to provide a universal health care system. So that's a totally different topic regarding health insurance and the nuances of integrating, public-private insurance. And this is just a social insurance program for paid family and medical leave purposes.
Okay, thanks. So let's talk about the bureaucracy piece of this, and I don't mean to be pejorative. Just the kind of the size of the administration of a program like this. Ashley, Rachel mentioned that was a concern of the chamber. It's creating a new, expensive, perhaps inefficient administration department. What's your response to that?
I don't want to pretend that this isn't a big, expansive program. This would allow 2.6 million workers access to paid family and medical leave. When we're trying to do something that covers all workers, we're going to have to do something big here. And we absolutely need that infrastructure to make sure that the program runs well, right? If we're offering something, if we're saying folks can take 12 weeks off, we need to be able to back it up with that. So, I understand the fears, but I also just don't see an action as a solution. This is something that's impacting people today. The pandemic is just exacerbating this need for people to take time off to care for their families. And when you have such a gigantic problem, it requires a gigantic solution. So I would just say that, yeah, this is a large program, as it should be, to make sure that the 2.6 million workers that do not have access to paid family and medical leave are getting the support that they need.
Rachel?
I'm sorry, Richard, you asked Ashley to respond to what I said about administration. What, was there a question for me?
Well, yeah, if you could, if maybe if you could kind of fill out what your justification is for a statement like that. I mean, will it be huge? Where do those estimates come from in terms
Those
of the
come from
size?
the fiscal analysis on this proposition. It's on the Secretary of State's website that's done by the state staff.
Okay, so it's on the Blue Book. Okay. Um, Rachel, I'm a low income worker. I get sick, or my family member gets sick. Um, and I need to take care of that person for a long, long time. What do I do? What's the alternative if it's not this?
Mhm. Well, Richard, I think there are a few options that could be considered. And we have advocated for a couple of things. One was that we start with a more reasonable safety net, see how it plays out in real life. As we've talked about a few minutes ago, we don't know how this is actually going to play out. In Washington State, they recently launched a program that's somewhat similar to this one. And in 3 weeks' time, they received what they thought was going to be 3 months worth of claims. And so they are so backed up in processing those claims that some people are waiting 10 weeks in order to get their benefits, and having to take out personal loans in order to make up the gap. And so certainly we don't want to set something up that will not deliver for Colorado families when they are most counting on it. So we had advocated for starting with a smaller, more manageable program. You can always add people as the program scales up, and as you learn things, it's pretty hard to scale it back down. So that was one solution. We've also supported an alternative that was sponsored by our own Representative Lois Landgraf from Fountain. She had proposed a program that was more incentive-based, that would allow employers to retain some flexibility, which is really important. One-size-fits-all solutions rarely work. And so we preferred her option. It also offered tax benefits for both employers and employees, and would have created something that was sort of like a 401k, where folks could put away money to plan for at least the situations that are foreseeable. So, if you know that you're going to have to take time off for some sort of medical procedure, you're planning to start a family, that you could put some money into a special savings account and your employer could match it. So those are some of the solutions that we have advocated for as alternatives to this one.
Thanks. Ashley, why were local governments exempted from this program?
There is a state law that says that local governments do not have to participate in an unfunded mandate. So since there is an employer share, that they can definitely opt in, but they can also opt out. That is state law.
So, Rachel, what's good for the local government, shouldn't that be good for small businesses?
Well, the premise of this program is that it is an essential benefit that everybody needs. And so I think it's a little hypocritical to let some folks opt out. And I'm familiar with the law that Ashley's referring to, but what really happens at the legislature every year is they pass on unfunded mandates to local governments all the time.
And we don't know if everybody's going to opt out. Just a interesting question. What about employees who pay into the system and never use the benefits they put in? Is there ever going to be a recourse for them to capture those funds back? Has that been thought of? Ashley, do you know?
So, I will just start by saying that with the average cost of the premiums, it would be, you can use this program once in a 1-year time span, and it would have paid for the cost of decades worth of premiums. And I just, you know, don't want to be morbid, but when we're talking about medical leave, caretaking leave, parental leave, there are very few of us who will not utilize something like that in our entire lifetime. And, you know, and a lot of this is a philosophical debate. Should we be caring for our community? Should we be caring for our neighbors? Should we be saying, you know, there is, you know, I can't guarantee that in 50 years I'm going to get sick or have a baby or have a family member who gets sick, but I want a little bit of assurance. And I want my community to have that assurance too. We have a lot of different programs structured similarly. I mean, that's how we structure taxes so that we can, as a community, have a flourishing society and that we're all contributing to that. And I think that's really important and why we're advocating for a social insurance program, because when you spread the risk across everyone in the state, it makes it so it's not a burden for anyone because we're all sharing in that together.
Can I respond to that, Richard?
Sure.
I think that these numbers don't add up. I mean, you've made a good point, which is there is a likelihood that you're going to pay into this program and not use it. If the proponents are saying that 80% of workers don't have these benefits, but only 3 to 5% are going to use them, I don't think that makes a whole lot of sense. And I would agree with Ashley that we do need to be taking care of our friends and our neighbors and our family members, but I don't think that the state ought to be telling us exactly how we're going to do that and what we're going to pay for it. You know, and that's something that the businesses that are part of the Springs Chamber really like doing, actually. You know, I could tell you a lot of stories about employers who made special arrangements for their employees that are completely outside the mandates of this program. And they did them because they do want to take care of friends and neighbors, or in this case, employees. And this measure would take away their flexibility to be able to do that in a way that works for everybody. One of our members was talking about how he had an employee whose husband had cancer, and for a year he set up work from home situation for her because she wanted to keep working, bought her a computer to work at home, gave her as much time off as she wanted to take care of him, and never charged her vacation or sick time. And under this program, he doesn't get to care for his employee in that way. That all goes through paperwork at the state level.
Can I just make a quick response just to the clarity around the numbers adding up between the 3 to 5% utilization and the 80% having an access? Those numbers might seem incongruous, but they're based on the fact that people aren't I'm not going to take paid family and medical leave every single year. Hopefully I'm not going to have an emergency every single year. So that is what we're talking about when it comes to utilization. While not everybody has access, not everybody's going to need to take leave in the same year. It's over a lifetime we're talking about.
So Rachel, won't a program like this, will that positively affect Medicaid costs and food stamps and all the other, won't it mitigate the use of those programs in a more efficient way?
I'm not familiar with any studies, Richard, that have tried to quantify that, so I'm sorry I can't answer that one.
Okay. Intuitively though, what do you think?
I don't know. I would hope so.
Ashley, would this proposal actually benefit spending on food stamps and Medicaid, kind of lessen that spending by substituting a program that keeps folks off those programs?
There is a body of research, which I'd be happy to share with you after this. I definitely need to dig into my citations. But it does say that as people have more access to paid family and medical leave, there's definitely a direct correlation between that and them utilizing other public assistance programs less.
Okay, great, thank you. That's all the questions I have, and I think that's all the questions that our audience has, and we're at about 45 minutes. So I'm wondering, Ashley, if you'd like to wrap up and say a few last words.
Yeah, I just want to say that once again, we need to think about the workers who don't have this, the people who are working multiple jobs and trying to put food on the table for their families and are one missed paycheck away from eviction. These things would be life-changing. I've talked to thousands of people who have said a paid family and medical leave program, if I had that at the time of need, this would have been life-changing for me. This is a big step forward in the right direction for Colorado, and inaction is no longer the solution. People needed this yesterday. They needed this today. We all know that the program doesn't start tomorrow, and every day that passes is another day that somebody in need is missing the birth of their child or the death of their family member or needing to figure out how to get to their chemotherapy appointments while, going to work the next day. It's just the moral, humane thing to do, to vote yes on Prop 118. And we're just seeing that it's good for economies, it's good for businesses, it's good for workers. And the downside here is pretty negligible. And I really think folks should go out, vote yes, Prop 118.
Thank you. Rachel, any last thoughts?
No, thanks, Richard. I'll just reiterate what I said at the beginning. This is a really well-intentioned policy proposal, but the reality is the devil's in the details. It's a significant tax increase on businesses and employees that's going to create a lavish new program that's destined for bankruptcy. And I think that Colorado voters ought to reject it, and we should create something that's going to work a lot better.
Great. Well, thank you both for participating tonight. We thank the audience for also participating and listening. We hope this was informative. We are going to hold one more ballot forum next week on Amendment B. You can get the details on cscono.org/webcasts. Thanks again, everybody. Have a great evening.
Thank you.
Thank you. Good night.
Good night.